Wait.
Hello, my name is Theodore Kalai.
And I'm Trent Cologne, and we're doing our presentation on Ureteropelvic Junction Obstruction, also known as UPJ. What is UPJ? UPJ is a partial or total blockage in the kidney or ureter area, which prohibits the natural flow of urine to the bladder. The kidney is the organ that produces urine and filters urine, and the ureter is the tube that connects the kidney and the bladder. The blockage can be caused by multiple things: a vein crossing the path of the ureter, after or before the passing of a kidney stone, and being born with the pinch in the ureter tube.
So some symptoms of UPJ. The main ones are urinary tract infections, vomiting, and back pain. But there are also some side symptoms, such as hydrophorosis, abdominal mass, and poor growth in infants. So who is most likely to have UPJ? So first of all, the first documented operation was conducted by Schellenberg in 1886, and it's most common in newborn babies. It is caused by a blood vessel crossing over the ureter and found in prenatal babies by ultrasound. 1 in every 1,500 pregnancies reveals fetal upper urinary tract infection, and 1 in every 500 infants have major urologic problems. 50% of people diagnosed with hydrophorosis also have UPJ, and it's twice more common in men than in women, and the left kidney is affected more than the right.
Some treatment options for UPJ. Most of the time it's surgery, but it depends on the severity of the case. In mild to moderate cases, doctors like to watch and have follow-up imaging of the kidney area to make sure nothing happens, and it's possible they can grow out of it. But if it does happen to become more severe or they catch it late, there's 2 types of surgeries. You can either have open surgery or robotic surgery. And open surgery is more your typical just one big cut and hands-on surgery. And robotic surgery usually has 3, 4, or 5 incisions in the abdominal area, which they insert robots to perform the surgery, and as well as a camera to make sure the robots are doing what they're meant to do.
So how can you prevent UPJ? Well, it's a genetic condition, so there's nothing you can really do to fully prevent it, but there are some things you can do to avoid it, such as avoiding kidney stones, urinary tract infections, and some kidney trauma. There are also some things that you can do to lower your risk, such as staying hydrated, consume more calcium-rich and less oxalate-rich foods. Also, lower your sodium and animal protein intake.
So I had surgery on UPJ on November 26, 2019, and I had a severe case of it. Although I was born with a vein that was not crossing over, but as I grew and got bigger, the vein crossed paths with my kidney, and it became a blockage. And I didn't have any symptoms, but I had back pain. It was not related. I had back pain, and I had to get imaging for the back pain done. And when they were doing imaging for my back pain, they figured out that I also had ureteropelvic junction obstruction, and so I had to do robotic surgery. And after like 3 or 4 weeks after the surgery, I had a stent placed, and so 3 or 4 weeks after the surgery, they had to remove the stent. And during that time that I had the stent in, it felt like I had to urinate even when I didn't have to urinate.
So in conclusion, what is UPJ? It's a blockage in the kidney area which prohibits the flow of urine from the kidney to the bladder. And the main symptoms include the urinary tract infections, vomiting, and back pain. And it's twice common more in men than women. And treatment options are either to just get surgery, whether it's robotic or hands-on, or to just grow out of it in less severe cases. And then it's a genetic condition, so it's not completely avoidable, but there are some things you can do to lower it, such as staying hydrated and avoiding other diseases.
And here are our sources.
Thank you.